Hi everyone, my name's Frank Quinlan and I'm the Chief Executive Officer of Mental Health Australia. I feel like I should either have a Santa hat on or a pipe in my mouth sitting by the fire to record a quick Christmas message at the end of what's been a really busy year. We all know that 1 in 5 Australians experience a mental illness each year, and sadly we know too that something like 7 Australians take their lives each day by suicide. So every day we get up and try and make a difference to the systems that can provide people with the support that they need. And this year's been no different. It seems like forever ago that we were gathering at Parliament House way back in February in the wake of the National Mental Health Commission's review of services and programs. We gathered with our members and we saw 45 politicians in one day to advocate for reform and to advocate for the sorts of reforms that we've seen unfold over the course of the year. That process saw us trigger off our countdown to reform as we awaited the government's response to the National Mental Health Commission's review. And those of you that follow our website will have seen our countdown clock slowly ticking away every day of the year, every minute and every hour, counting down the time for the government to respond. Happily, we've got that response now, and I think at the end of this year we really are much better placed to face the year ahead with a clear idea about where we're heading and the sorts of reform measures that we need to implement over the course of the next year. In addition to those activities around the National Mental Health Commission's review, we haven't been standing still on many of the other reforms that are afoot as well. We've had the National Disability Insurance Scheme trials rolling out, or pilot sites rolling out, and the policy debate ramping up, and we've been a part of that. We've also had things like the Federation White Paper review, making important decisions about how the federal government and state governments will get together and support funding and future programs and services. Importantly, we've engaged and continue to engage closely with the many consumers and carers that our work brings us into contact with. We have a wonderful national mental health consumer and carer forum that we're pleased to work alongside with, and we really value the sort of input that group can provide us and the sort of advice that they can give us as we set about to advocate policy changes as well. We come to the end of the year, I think, pleased that the National Mental Health Commission's review is out and that the outline of next year's activities are laid for us. We're going to see a lot of work rolled out through primary health networks. We're going to see the development of stepped care models. We're going to see commissioning based on flexible funding pools that primary health networks will have responsibility for directing in the future. And so it'll be a time of very substantial change for the sector. At the same time, we'll see the National Disability Insurance Scheme ramping up, and that's also going to have a big impact. So I think it is going to be a difficult time in many ways, but I'm also hopeful that it'll be an optimistic time for many of us. We've been looking for systematic reform for a very long time, and we know that if we're going to make systematic changes, things are going to end up looking very different when we complete those reforms to what they do now. We're going to continue to play our role in advocating for substantial reform of the mental health system for and on behalf and with consumers and carers, those people that need those services most. And we'll stand alongside our many members and many supporters who are just as vigorous in their advocacy for change. But in the meantime, we are going to take a break, and I hope some of you will at least get a break too. Christmas is a time, I guess, where most of us get a chance for either a bit of quieter time in the office or a more substantial break away with families and friends. We remember, of course, that that's not always a great time for many of the people that we work with, that Christmas can be an occasion of reminders of loss and loneliness. So I hope for you, it's a refreshing time. I hope that you can reach out to those around you and gather up the energy that you'll need for the year ahead. That's certainly what we're doing here. I'm lucky enough to be taking a long break myself and looking forward really to coming back to a new year of new challenges, perhaps described as the challenge of implementation rather than the challenge of reform. And from all of us here at Mental Health Australia, from Jennifer Westacott, our chair, from our board members, from the really committed staff who've just worked so hard over the course of this year, to all our supporters and friends, a very Merry Christmas, have a great break, and come back to the year ahead ready to build the sort of system that we really think we need in order to make a difference in people's lives. Thanks for your support this year.